Welcome to the first episode of the Medicare Team podcast. Today, we're going to be going over just some basics of Medicare. And Josh, we're both. My name's Josh, and we have another Josh over there.
My name's also Josh.
We're just going to be discussing some basics of Medicare. We're licensed agents, and the Medicare team here has helped thousands of people with their Medicare. So today we're just going to go over some helpful tips and mistakes that you would want to avoid.
Today we're breaking down Medicare in plain English. No pressure.
No pressure. So Medicare could definitely feel quite confusing for a lot of people. I don't completely know who designed the system, but it's not very easy. It took me 6 months during training to really comprehend what was going on. So I completely get it if you feel confused going into Medicare. There is quite a lot to gather.
And it's wild because once you know what you're looking at, Medicare is quite simple. But if you don't know what you're looking at, the way they lay it out, it can be so confusing and there's so many things to look at. But that's why we're here as licensed agents, that we want to help at the end of the day. We want to make sure people are getting all the best benefits they're entitled to, because if we do our jobs right, then your quality of life goes up.
Yeah. And not only that, we'll be here for you now, but we'll be here for you in the future during your entire Medicare journey as well.
Absolutely. And that's what makes this job great.
Yeah. So we could go into original Medicare then. So original Medicare is Medicare Parts A and Medicare Parts B. I know that we're going back to our ABCs here, but but original Medicare Part A is what I like to call is like the hospitalization. It's for like your room and board at a hospital. So it helps pay the costs of your hospital room, things of that sort. That's just an oversimplified version of Part A. And we also have Medicare Part B, which I like to say it pays for your medical services. So like your physicians, if you need a surgery done, things of that sort is going to be covered under Part B. And that's under original Medicare.
Which then brings us to Medicare Part C.
Medicare Part C is basically simply when the private insurance company takes over for managing your healthcare instead of the government. And these types of plans are called Advantage Plan, Part C. You'll probably hear them interchangeably. They mean the same thing. It's when a private company takes over for managing your Medicare from the government, and these plans can often offer additional benefits such as hearing, dental, vision benefits as well. They could also give you access to a gym, YMCA in your area if you want to go, to the pool. There's a lot of benefits to Advantage plans, as well as having a max out of pocket.
And oftentimes, these Advantage plans come at $0 monthly premiums, which people get a little thrown off at that. How am I getting these $0 monthly premiums? Well, when you've worked your whole life, the government pays these insurance companies to help take care of people in their retirement age. So because you worked, you're entitled to these benefits. You've earned them. So why not have them?
Yeah, as long as you have Medicare Parts A and B active, they cost you zero. A lot of these plans cost $0 in addition. Um, but we do need to make sure, those who are watching, we need to make sure your doctors and medications are covered. Because with these types of plans, they have networks, which I would like to say each plan has their own team of doctors that work with them and medications that they take. So we just want to make sure that the doctors you're currently seeing and the medications you're currently taking are going to be covered under the plan's team, if that would make sense. Because if it is, you're not going to see that much difference in coverage, and you can get access to a lot more benefits that you are entitled to.
Exactly. And we're not here to just put somebody on a plan. We get this information because we want to get somebody on the right plan for them, whatever is going to be best for their health and their wallet. We want to make sure this is going to cover all of your doctors. We want to make sure that your medications are covered and you're taking as little out of your pocket as you can.
Yeah. Every person's unique. Every person's different. And that's why we as licensed agents need to talk to each person uniquely. We can't just recommend one plan because every plan's different and every person's needs are different. For sure.
Now, not to leave out Medicare Part D, you can either have your Part C, which is that Advantage often we spoke about, but then there's Part D, which is going to be your prescription drug coverage.
D is for drugs.
D is for drugs.
So prescription drugs is covered under Part D, And a lot of these Advantage plans will have that included within at a $0 extra monthly premium as long as you have your Part A and B active and are paying the premium for your Part B. So, and then Medicare Supplement versus Medicare Advantage would be the next topic we're going to go into today. So Medicare Supplement is on top of your original Medicare. So there's two routes you could go that will help give you coverage because under original Medicare, there's a lot of holes in it, such as there's no maximum you're gonna pay in a year. There's no coverage there. So for instance, if you had $100,000 hospital bill for a surgery, which I mean is way too common these days, you could just trip and fall, have to go to the hospital surgery. After your deductible's paid, you're going to be on the hook for $20,000, which is a lot. And we just want to protect you from that. So there's two ways to do it. You could do it through Medicare Supplement Plan, which is basically like insurance on top of original Medicare to cover the holes. Or we could do it through an Advantage plan, which is when the government basically contracts with these private companies to manage your Medicare, but they come with a maximum out of pocket to help reduce those costs. And a lot of times they have set co-pays where you're not paying a percentage, like 20%, you might just pay a set copay of a couple $100s to get services done.
And I don't know about you, I'm not ready to pay $20,000 out of pocket today. God forbid something happened to me and I had an accident.
I don't know, Josh. You might have a shoebox full of 20 grand in your backyard. So
I would love to find a shovel and start looking for that.
yeah. So Medicare supplement plans, your most common ones are Plan F, G, and N. And those plans typically are going to cover uh, a majority of the holes that a Medicare supplement plan would. Um, that original Medicare has. So, Plan F is no longer available to those who were eligible for Medicare after 2020. The government shut that one down. But Plan F and G are very, very similar, except that with the Plan G, you have to pay your Part B deductible when you first go to the hospital. But a lot of people like Medicare Supplement over Advantage plan if they like to travel a lot, or if they don't want the hassle of networks with a Medicare Supplement plan. As long as your provider accepts Medicare, you just go and you show both cards and you're going to be covered. Besides that Part B deductible. So after you pay that Part D deductible out of pocket, depending upon the plan you choose, you will have no additional charge. So it could give you a lot more freedom. But these types of plans also don't come with any type of dental. You have to buy your prescription drug coverage separate from it, so that could be additional cost you got to account for. Um, but the benefit is you have very predictable costs. Every month, the premium for the supplement plan is going to be very predictable. It is not going to be changing a lot. Every year they do change. They do increase, especially as you age, because when you get older, they increase the premiums of these plans for you. But it's very predictable costs. As with an Advantage, it's more like a pay as you go.
Yeah, and for some people, something like a supplement plan is best for them because of their health, because of their travel habits. And for some people that may be on a different wave, those Advantage plans are what's going to be better for them.
Mm-hmm.
There's no best plan out
Mm-hmm.
there. It's just what's right for your situation.
Yeah. And with these supplement plans, you just also got to think you're paying for that flexibility. So you're most likely going to be paying a couple $100s extra a month on top of your Part B premium for these plans. While with an Advantage, you're paying a lot of times $0 more than your Part B premium. So if you're never going to the hospital or going maybe a couple times a year, then these Advantage plans are definitely going to be a better fit for you. Because you're paying as you use it. If you're not using it a lot, it's going to be better fit because you're going to save uh, almost a couple thousand a year you could on premiums on a supplement plan. So, yeah. So let's go to enrollment periods and penalties. So there are different enrollment periods. So for supplement plans, you do have your open enrollment period when you first turn 65. It lasts for the first 6 months that you've become eligible for it, and that's when you have your guaranteed issue rights in that. So meaning that you do not need a health screen to join these plans. After that time, unless you have some type of very special exception, you're going to have to go get a health screening done to be able to join the plan. And they can deny you, or they can increase your rates based off of that. Another way that you are able to have guaranteed issue rights is if you are already on a supplement and you've never left it before. If you want to try an Advantage plan out, you can also leave your plan, try the Advantage plan out. If you don't like it within the first 12 months, you're able to leave that plan and go right back to the plan you were just on with guaranteed issue rights, meaning that they can't deny you based off of any health. So the government put that out there for y'all to be able to go test out Advantage and see if that might not be a better fit for you.
Yeah.
So,
And don't you forget about the initial enrollment period.
okay, yes. So now we're going on the Advantage side. So that was on the supplement side. The initial enrollment period is for Advantage, and that lasts 3 months before the month of your 65th birthday, and 3 months after, unless you're born on the first. But you can worry about that later. We don't need to go into detail with that. um, but 3 months before, 3 months after. So as long as you have activated your Part A and B at your 65th birthday, you could sign up to 3 months before for Advantage to go active the day your Part A and B go active. If you want to do it after your Part A and B go active, so for instance, the month of or the 3 months after, um, then they will go effective the first day of the following month. So, for instance, if your birthday's in April, like mine is, and you're just turned 65 in April and you didn't sign up till April, April, May, it would start in May. So you start the following month. And yeah, I think that's for the initial enrollment period. Also, there are special enrollment periods for different situations. We're not going to go into too much detail during this podcast on that. If you talk with one of us, a licensed agents, we're trained on these special enrollment periods. Um, so we can help you out with that if you schedule an appointment with us.
Yeah, and the one that comes around every year is the annual
Mm-hmm.
enrollment period, which that's going to be from October 15th through December 7th every year. And that gives you the opportunity to take a look at your Medicare, see what new plans have released, and see if there's something that might be more beneficial for you, that might bring more of your doctors in a network, that might give you another benefit you didn't have before, whether maybe you needed more dental or more prescription coverage. That's an excellent time to look at your options to see what's going to be available.
Yeah, yeah, and those are majority of the enrollment periods. And like I said, we don't want to get into too much detail. We're just doing kind of a basic overview. If you want some more information, you can schedule an appointment with us, and we can help examine your needs as well. So what is changing for 2026? So there is a lot of big changes, especially with like the food allowance. I don't know if you want to go into that a little bit, Josh.
So the food allowances, if you have a chronic special need, and that's typically going to be something like if you're a diabetic or if you
Basically, if you're on a chronic special needs plan, you have no issue because you already have a qualified chronic condition. But if you're in Medicaid, so if you have Medicaid, the plans the years before, y'all have just gotten your food allowances, and your allowances for food, utilities, rent. A lot of them include are um are all included, meaning that you're going to be able to get them no matter what your condition is, as long as you have access to Medicaid with for these dual plans. But the government changed it this year. Well, now even if you're on a dual plan, you'll still get that money for over-the-counter items. But if you want to use it for rent, utilities, groceries, things of that sort, you have to have a qualified condition, and a lot of them are like heart, diabetes. If you have a kidney issue, and there's a long list of qualified conditions. It was estimated that 90% of people that are on Medicaid will still be able to get access to these benefits, but it is a noticeable change for 2026. Um, and then just a note, every year these Advantage plans do change, just let you know. So, expect that every year your plan's changing. You'll get a summary of change in the mail, review that, talk to your agent every year to kind of get familiarized on what the changes are. So it's very important to know what's going on with your healthcare.
And I always recommend find an agent you like and stick with them because
Mhm.
they're going to know your situation. You're not going to have to go over things 1,000 times with other people. And then they are always going to make sure that you are on the best plan for you. Their concern won't be changing your plan. Their concern will be making sure that you are taken care of.
Yeah. And choose someone who's service-based, who wants to help you, and also isn't going to, be angry at you questioning just questioning stuff on basics of Medicare. You wanna find an educator who's there to help educate you. So it'll be definitely good to find one good agent and stick with them, um, and it's gonna be the most helpful for you. And you might see advertisements around trying to advertise benefits and stuff like that, but I would just ask the agent that you're with, if he's a good agent, of course. If you don't like your agent, of course, you can find a new one. Um, but most of these agents, all of them, I believe, you could go, c- you could go get a free consultation for free for
Yeah, talking to an
$0.
agent doesn't have any effect on your current or your future health
Hmm.
coverage. But if you have questions and you want to know things about Medicare, speaking to an agent will be a huge help for you because they're a resource. They can let you know what
Hmm.
you're looking at and they can break down those questions you might have about your Medicare to make sure it's something you understand.
Yeah, and if you're looking for an agent, of course, you could use us here at the Medicare team, but look for a broker. So someone who's not just limited to one organization, who can explore multiple organizations and be able to select a plan that would be best for your fit, not just best for the carrier.
It really makes sure that the benefits you're getting are truly the benefits that are best for you if they have multiple options so they're not focused on trying to get you set into a certain carrier.
Yeah, yeah, because a lot of people you might see advertised are just stuck with a specific carrier, and they can't explore options outside of that carrier. So that's something to keep in note when you're looking for an agent. So, um, when to get help, you should get help as soon as you're going into Medicare. Is one of the best times you can get help. Um, so you're gonna want to before your 65th birthday. I would recommend even 3 to 6 months before your 65th birthday, getting in contact with an agent, getting your current needs down, taking a look and seeing, if there isn't a good choice, because these plans do stay the same for the entire year. So getting in contact with someone and getting that all set up so that you're all taken care of, in case there's any delays. You know, with the industry, the government, sometimes there's delays with these things, so the sooner the better. If you're past the age of 65, of course, any time right now is the best time. So, get in contact with a licensed agent and let them help you assist you. They've had years of experience. They've seen almost every situation, so yours isn't anything special, and they know how to navigate that. So it's definitely gonna be very helpful for you to do something like that.
And if you're not sure where to start with finding an agent, talk to your friends, talk to your family to see
Mhm.
if they have an agent that they like. I know that in my day to day, I have people that send me their sister or they'll send me, a friend who needed help with Medicare that hasn't been able to have somebody that'll break it down for them and explain them. So see if somebody in your life might have somebody that's great. You never know where they're going to find them.
For sure, for sure, for sure. Um, and we're gonna be talking about next episode, what's the what's real, what's the hype, and what you need to know about 2026 Medicare. So that's the just give you a little tease. That's what we're gonna be talking about next episode. Um, and if you want to book with us, I'm sure there'll be something down in the description where you can book an appointment with one of our agents here at the Medicare team, and we'd love to assist you, and we'd love to be your agent for life.
Come talk to us. We'd love to hear from you. We'd love to help you make sure that you are getting all the benefits you're entitled to.
Mm-hmm.
And thank you so much for tuning in to the Medicare Team podcast.
Yep. Have a great week, guys.